Let's discuss about common abbreviations in OET writing.
PTT, partial thromboplastin time. PU, past urine. Q, every. Q1D, every day. Q1H every hour. Q2H every 2 hours. Q4H every 4 hours. Q6H every 6 hours. Q8H every 8 hours. QD, every day or daily. QDS 4 times a day. QH every hour. QID, 4 times a day. QS sufficient quantity. QOD, every other day. PO, perorally. PC, presenting complaint. POP, plaster of Paris. TTA, to take away. TTO, to take out. UND, urea and electrolytes. UD, as directed. UCC, urgent care center. UT, urinary tract infection. VLDL, very low density lipoprotein. VTE, venous thromboembolism. IVP, intravenous bellogram. INR, international normalized ratio. ED, emergency department. EEG, electroencephalogram. EMU, early morning urine sample. ESR, erythrocyte sedimentation rate. EUA, examination under anesthetic. FBC, full blood count. FY1 FE2 foundation.
BSE, breast self-examination. FHR, fetal heart rate. ICP-Intracranial pressure. MRI, magnetic resonance imaging. RSV, respiratory syncytial virus. MDI, metered dose inhaler. VSD, ventricular septal defect. CVP, central venous pressure. CNS, central nervous system. ECG, electrocardiogram. INR, international normalized ratio. PT, prothrombin time. ECMO-Extracorporeal membrane oxygenation. ERLP, endoscopic retrograde cholangiopancreatography. TSH, thyroid stimulating hormone. ELISA, enzyme linked immunosorbent assay. ADL, activities of daily living. FBE, full blood examination. PIH, pregnancy induced hypertension. CRP test, C reactive protein test, HIE, hypoxic ischemia encephalopathy. CP, cerebral palsy. ICD, implantable cardioverter defibrillator. TAVR, transcatheter aortic valve replacement. ACEI, angiotensin converting enzyme inhibitors. Acute kidney injury. GFR, estimated, glomerular filtration rate. QOL, quality of life. 1/121 month. 1/521 week. A.C. Before meals/food. A.M.in the morning. An antenatal. A pantero-posterior. AP, antepartum hemorrhage. CA/cancer, carcinoma, calcium. CABG, coronary artery bypass graft. C8, coaxial or computerized axial tomography. CB, cognitive behavioral therapy. CHF-congestive cardiac failure. CN, central nervous system. COAD, chronic obstructive airways disease. CS, cerebrospinal fluid. CT, cerebral tumor, coronary thrombosis, computerized tomography. CV, cardiovascular. CVA, cardiovascular accident, cerebrovascular accident. CV's, cardiovascular system, cerebrovascular system. CX, or chest X-ray. DN, district nurse. ECF-extracellular fluid. ECG, electrocardiogram. ECG, electroconvulsive therapy. F4, in body. FB, full blood count. Gram. GP, general practitioner. HPV, human papillomavirus. HRE, heart rate. HC, heart sounds. ICF-intracellular fluid. CIS, intercostal space. ICU, intensive care unit. IC, intelligence quotient. IV, in vitro phenylization. LF, liver function test. L, plumber puncture. Milliliter. Medical officer. MOH, medical officer of health. Nasodium. ENS, nervous system. OBS, obstetrics. OPD, outpatient department. OT, operating theater. OT, occupational therapist. P.M.in the afternoon. RBS, random blood sugar. RC right coronary artery. RN registered nurse. ROM range of motion. SOB show of breath. URTI upper respiratory tract infection. XR X-ray. Soles pace occupying lesion. EDH Epidural Hematoma. SDH subdural hematoma. SAH subarachnoid hematoma. L left. Lab laboratory. Lat lateral. LL cleft lower quadrant. LUQ left upper quadrant. LNVLIVING and well. CV cardiovascular. DX diagnosis. EEN tears/eyes/nose/throat. F4 in body. HEEN thed/ears/eyes/nose/throat. HOP history of present illness. History. IC intercostal space. INSP inspection. MSc mental status exam. MSK musculoskeletal. NNVNAUSEA and vomiting. ANVALIVE and well. Abdomen. Anterior. Apanteroposterior. Beal blood pressure. OU both eyes. OD right eye. OS left eye. Pulmonary. PNAPERCUSSION and auscultation. PA physical exam. PA present illness. Seen cranial nerves. C/O complaints of. D/C discontinued. D disc diameter. DJ degenerative joint disease. Deem diabetes mellitus. Works treatment. Symptom. Team tympanic membrane. Unwell nourished. WN within normal limits. Owl anterior axillary line. Ad lib freely, as desired. ANPANTERIORLY and posteriorly. ASA aspirin. A/artery to vein ration. BM basal metabolic rate. BS bowel sounds with. CHF-congestive heart failure. PMH past medical history. Post posterior. Prognosis. Right. RL crite lower quadrant. RU crite upper quadrant. R/orial out. ROM range of motion. CN central nervous system. INO intake and output. IUD intrauterine device. IV intravenously. JV jugular venous distension. LM plast menstrual period. LOC-level of consciousness. M murmur. Mal mid-axillary line. NAD no acute distress. NC/8 norinocephalic/atraumatic. O or onon or no. OB obstetric. Obese organic brain syndrome. Obd patient department. PAL posterior axillary line. PME point of maximal.